Hi, we're Group 8A, and our marketing plan pertains to the HIV Adherence Program. During this presentation, we'll be going over the introduction of the program, what our assumptions are, our target audience, our message, our promotional methods, and lastly, a summary of our promotional plan.
Husky Pharmacies caters to the Boston area, and we plan to implement this service for HIV adherence at 4 of the locations. The pharmacists have undergone extensive training involving both self-directed and live session portions with assessments at the end of both trainings. At the end of the overall training, they'd be proficient in practical communication with patients, drug interaction screening, and knowledgeable of the complexities an HIV diagnosis comes along with. This training was in preparation for the service's launch, which will expand the involvement of Husky Pharmacy in the care of HIV-positive patients. The service would include individualized patient counseling with follow-up visits checking on their progress. HIV medication adherence is extremely important as it is only effective when taken 90 to 95% correctly. The program was also incentivized through mass health resources, such as reimbursement for each counseling session and data to identify which patients are in the highest risk category. Despite the incentives and training, the initial launch of the service yielded very few sessions and even less follow-up appointments. Only 5% of patients attended the first appointment and 60% of them returned for the follow-up. When surveyed, patients who declined the service said they felt as if they didn't need to speak with a pharmacist or they weren't comfortable speaking with them about the service. To overcome these barriers, we need to first build trust between the patient population and secondly, emphasize the importance of taking their medication correctly. These two overarching goals can be achieved through specific marketing ventures, which we will be discussing later on.
Before we address our marketing plan, we have to make a few assumptions. First, we assume that testing for HIV is relatively simple and treatment for HIV is also relatively simple, given patient compliance. We also assume that patients are able to access the pharmacy and related services. Lastly, we assume that the pharmacy has all the resources necessary to perform the service, including the money, personnel, medication, venue, and any other equipments needed.
Our primary targets are patients who are diagnosed with HIV, people who have HIV but are not diagnosed, physicians who specialize in HIV, and family members of those who have or are at risk of HIV. Our program is specifically targeting those residing within or near Boston, Massachusetts. To those people, we hope to explain how our program of highly trained and trusted pharmacists are there to provide the necessary steps to keep them living a healthy life. Depending on the type of consumer, each message will be altered to appeal to the specific consumer. For instance, when speaking to the patients themselves, the message given will be both alarming and comforting, as we would mention first how HIV is a disease that can lead to serious complications, but can also be controlled as long as it is managed well and thoroughly. In order to appeal to our providers, we want to highlight our expertise as medication experts and emphasize collaboration. Furthermore, this program would also provide an opportunity to reinforce the importance of health and treatment while also saving the time and effort for physicians. Lastly, for caretakers, we would want to emphasize how our program could help to take care of their loved ones, thus alleviating their burden.
Ideally, the promotional methods used would span a variety of media, reach our target audience, and be cost-effective. In order to get physicians on board, personnel selling would be utilized because it would allow a sense of trust and credibility to be earned with time, which would ultimately result in patients trusting the program as well. Again, our main message would highlight the expertise of the pharmacists involved in the program and the idea that the program is enhancing, not competing with their practice. If the physicians agreed to endorse the service, flyers would also be created to leave at the offices and clinics, further emphasizing the partnership between physicians and Husky Pharmacy in the patient's eyes. The remaining methods would be aimed towards the patient and caregiver populations. Social media and television advertisements could be used to reach the younger and older audiences respectively with a standardized message. As an incentive, Husky Pharmacy could offer a free HIV antibody and antigen testing, the results of which would be discussed at the consultation. Better understanding of their results and the disease in general might help improve adherence and make them more likely to attend follow-ups in the future. Lastly, publicity would be a cost-effective promotion to not only bring awareness to the HIV adherence program, but also to spread a positive perception of the pharmacy itself.
In conclusion, we'd like to summarize why a marketing plan will work. First, we reach a broad range of audiences across different patient demographics, as well as physicians and caretakers. We address each of the patient concerns leading to the initial suboptimal participation of the program. We also focus on relationship marketing, which takes time and effort, but creates a win-win situation for everyone involved to ensure that relationships between patient and providers last into the future. Lastly, our marketing venues are cost effective, so they would save money both for the pharmacy and the marketing department. Thank you so much for listening to our pitch, and we hope to have your support.